Leticia Vera here from TrueCare, and I just want to tell everybody your title because it was so long I could not even get it on the screen. So you're the Director of Patient Retention and Engagement at TrueCare. Let's just start from the beginning. What is TrueCare? What services do you offer?
Yes, thank you for having me first. Good morning. TrueCare is a community health organization that provides care to people of all ages. We have been around a little over 50 years, and we have grown into a network of 22 health centers and 5 WIC locations. We provide, again, health care to patients regardless of the age, income, or insurance status, or their background. We provide services such as primary care, pediatrics, behavioral health, we have pharmacy services, we have lab, x-ray, we have acupuncture, podiatry, dental services, so a very, very comprehensive range of services.
Amazing, and so important that we had you on this time of year, because it's that time of year, open enrollment for people interested in Covered California or Medicare. The deadline for that is January 31st. What do you think it's really important that our viewers understand this time of year?
Okay, so yes, we are in the middle of open enrollment. I do have to mention that for Covered California, the deadline is January 31st. So anyone that needs to apply or make changes to their health plan, they have until that day. Unfortunately, if they're not able to do it during that time, then they will have to wait until the next year, or if they have a life-changing event in order to apply outside of the open enrollment. And for Medicare, it's the same concept, but the deadline for them to apply is December 7th. So,
okay, so
just a couple of days.
Deadline is quickly approaching. So what happens? I mean, if you do miss that deadline, like you said, you just got to wait it out and see what happens.
Yes, for the most part, or if you have a life-changing event, you get married or something changes within the income, or you lose the insurance that you had through work. So there's specific events that they can.
Well, I know in addition to providing services and care for our community, you really want to make sure people are educated. So people can head to TrueCare.org to learn everything. What are some of the things we can discover on your website when it comes to taking care of ourselves and our loved ones?
Well, like I said, we have a very comprehensive range of services, and one of them is the enrollment services that I think right now in open enrollment is very important to be aware that that's some of the services that we also provide for free to anyone. They don't have to be our patients to receive the services.
You know, and I'm looking at this video, and I remember a couple years ago we did actually come out to one of your locations, and they're very nice. I mean, the staff, I remember, was so friendly as too. What do you think sets TrueCare apart from other doctors' offices and buildings in our area?
Well, I think one of the biggest thing I will say is the culture. I think we have been really, that has been the main focus, and we have really staff that want to help, or they love their job. We love our coworkers, and again, there's such a like a family. It feels like a family, and it's great to see people working toward the same goal.
I know, and you have been with the company for about 18 years. I can't believe it. You look amazing. Your job's not wearing you out, so you must truly love it. Why do you personally want to serve our community in this capacity? Well, I think I came to TrueCare just almost like by accident, but once I saw the impact that we can have in our communities, how there's need. There's sometimes we can be so naive and not know what is out there, who is going through something. So when I went to TrueCare and I was seeing the services, the population that we were serving, it just touched my heart. So it's been a privilege to be there for this long. Wonderful. Well, we really appreciate you taking time from your schedule to join us today. So one more time, those deadlines, January 31st for Covered California and December 7th for Medicare, correct? Yes, that is correct. And I also do want to mention There's open enrollment for those two programs. There are changes coming up for Medicaid, the Medicaid program. So the eligibility are going to be changing starting next year. So even though Medicaid doesn't have an open enrollment, it's very important that people that are not enrolled right now that apply before the end of the year. So pretty fast. So. And also, those that are already enrolled, it's very important that they continue to maintain their insurance, and that is by updating their contact information and also submitting the renewals on time.
All right, Leticia, thank you so much. We will be right back.